1 in 3 seniors may be risking a stroke every single night, and most have no idea. I want you to picture this. You go to bed feeling perfectly fine. You fall asleep to your favorite television show or the sound of the rain outside. Somewhere between midnight and dawn, something changes in your body. Your blood pressure spikes, your heartbeat stumbles, or your airway narrows and a small clot begins to move toward your brain. You don't feel pain. You don't hear an alarm. But brain cells are dying. By morning, you may wake up unable to move one arm, unable to speak clearly, or you might not wake up at all. That's why today's topic is so important. We're going to look at why strokes can happen during sleep and safer ways to sleep after 60 that could protect your brain for years to come. I'm Dr. Ethan Wells, and I've spent over a decade working with seniors to protect their hearts, brains, and independence. In those years, I've learned that the scariest health problems are often the quietest ones. Let me tell you about a man named James, 72 years old, retired teacher, active in his garden. One evening, he and his wife watched a movie and went to bed as usual. The next morning, James tried to get up, but his right leg wouldn't cooperate. His speech was slurred. His wife called 911 immediately. In the hospital, we confirmed it was a stroke likely triggered in the early hours of the morning. James got lucky. He received treatment quickly and regained much of his function, but what struck me was his question to me. "Doc, how can a stroke happen when I'm sleeping? I wasn't even doing anything." That's the exact question we'll answer today, and I'll also give you practical steps you can take tonight to make your sleep safer. Causes: 1. Blood pressure fluctuations at night. During deep sleep, your blood pressure naturally drops. Think of it as your body putting the circulatory system into rest mode. But in older adults with narrowed arteries, this drop can reduce blood flow to already tight vessels in the brain. On the flip side, certain sleep phases, especially REM sleep, can cause sudden spikes in blood pressure. If a weakened vessel wall can't handle the surge, it may rupture, leading to a hemorrhagic stroke. 2. Atrial fibrillation, AFib. An irregular heartbeat can cause tiny clots to form in the heart's upper chambers. When you're lying down, blood flow patterns change. It's like a river slowing in some spots and swirling in others. That swirl is where clots can form. If a clot breaks loose during the night or early morning, it can travel to the brain in seconds. 3. Obstructive sleep apnea, OSA. Sleep apnea causes your breathing to stop repeatedly during the night, cutting off oxygen to your brain. Each drop in oxygen makes your blood vessels constrict and your blood pressure rise, stressing your heart and increasing clot risk. Over years, it damages the lining of your blood vessels, making them more prone to blockage. 4. Sleeping position and circulation. Certain sleep positions can compress blood vessels in the neck or restrict airflow. Imagine bending a garden hose. Water still flows, but more slowly. The same thing can happen to blood flow if your head is turned sharply or your neck is compressed for hours. I once had a patient, Mrs. Ellen, who always slept on her stomach with her head sharply turned to the right. Over time, this position contributed to reduced blood flow through one carotid artery. She didn't notice until one morning when she woke with vision loss in one eye. That was her warning, a transient ischemic attack, and it led to major changes in her sleep habits. Safer ways to sleep after 60. 2-1. Sleep on your left side. This position may improve circulation and reduce pressure on your body's largest vein, which returns blood to the heart. It's especially helpful for people with mild heart failure or acid reflux. For stroke prevention, the goal is to keep blood moving freely and evenly to the brain. Tip: use a pillow between your knees to maintain comfort. Caution: if you have specific heart conditions, check with your cardiologist. 2. Slight head elevation. Raising your head 10 to 15 degrees opens the airway, reduces snoring, and keeps oxygen levels stable. Even a small incline can prevent airway collapse in people with mild sleep apnea. Tip: try a wedge pillow or adjustable bed. Note, keep the neck neutral. Too much elevation can cause muscle strain. 3. Cool, well-ventilated bedroom. Cool air helps regulate blood pressure and keeps your heart from working too hard during the night. Overheated rooms can trigger restless sleep and nighttime BP spikes. Tip: set the thermostat between 65–68 degrees Fahrenheit, 18–20 degrees Celsius. 4. Avoid late heavy meals, excess salt, and alcohol. Large, salty meals raise nighttime blood pressure, while alcohol can trigger irregular heartbeats. Both effects can make the night more dangerous for someone at risk of stroke. Tip: finish dinner at least 3 hours before bed. Swap alcohol for herbal tea. 5. Consistent sleep schedule. Your heart and brain like routine. Going to bed and waking up at the same time every day keeps your cardiovascular system in rhythm and reduces stress hormones. Tip: avoid staying up late on weekends. Even one disrupted night can affect blood pressure for days. 6. Screening for sleep, apnea, and AFib. These two conditions are major, treatable stroke risks. Treating sleep apnea with CPAP or AFib with medication and monitoring can dramatically cut your risk. Tip: if you snore loudly, wake up tired, or feel your heart flutter, see your doctor for a sleep study or EKG. Here's what I tell my patients. Stroke is a brain emergency. Every minute after a stroke starts, you lose about 1.9 million brain cells. That's why doctors talk about time is brain. If you ever wake up with sudden weakness, numbness, trouble speaking, trouble seeing out of one eye, or a severe headache, even if it fades quickly, you must act as if it's a full stroke. Call 911. Don't drive yourself. Don't wait to see if it gets better. I've had patients who got to the hospital within 90 minutes and walked out 2 days later with almost no symptoms. I've also had patients who waited, thinking they were just tired or had slept wrong, and now live with permanent disability. And let me reassure you, it's always better to have the hospital tell you it's nothing serious than to find out too late that it was something life-changing. You're not wasting anyone's time. You're protecting your brain, your independence, and your future. Let's bring it all together. We've talked about why strokes can happen during sleep, from blood pressure swings, to irregular heartbeat, to sleep apnea, to certain positions that restrict blood flow. We've gone through practical, safer ways to sleep: left side sleeping, slight head elevation, cool bedroom, avoiding heavy, salty meals and alcohol before bed, keeping a consistent schedule, and screening for sleep apnea or AFib. I want you to imagine tonight, as you lie down, making just 1 or 2 of these changes. It might feel small, but that small change could be the reason you wake up tomorrow and every day after with your mind sharp and your body strong. If you know someone over 60, please share this video with them. You could be giving them a second chance at life. And if you found this helpful, subscribe and stay with me, because in my next video, I'm going to share 4 everyday foods that silently increase your stroke risk, and I promise you, they're probably in your kitchen right now. I'm Dr. Ethan Wells, helping you live smarter, longer, and stronger.